Here to talk more about the healthcare exchange and other ideas, we have the chair of the Senate Health and Human Services Committee, Senator David Hann. Thanks for joining us today.
Good to be here.
We're going to get to the healthcare questions in just a moment, but first, again, the big news here at the Capitol. The governor came on Tuesday and stated that essentially a local option tax is nothing that's going to be able to happen.
Sure.
Concerning a Viking stadium, you were public last week along with Ann Lincheski and Republicans and Democrats from the House and Senate, essentially saying that expanding gambling is also off the table for you, and yet that seems to be the revenue source that's going to be debated at this point. So did you see the writing on the wall?
Well, I was very skeptical that there would be an opportunity to pass a local tax without a referendum. So this was not a surprise to me. I just didn't think that that was very realistic to begin with. But with respect to financing a Viking stadium with gambling, of course, as you know, I'm opposed to that, as many others are. I think that is not a good idea. I think the costs to the public outweigh the benefits. However, that being said, it's certainly possible to figure out how we could do a deal with the Vikings or any professional sports team. The real problem is that this model that the professional leagues, not only football, but probably baseball and hockey and basketball, these models, these national models are broken and they need to be fixed. These are monopoly organizations that simply go around the country and hold the public hostage to get whatever money they think they want out of the public taxpayers' purse, and we should stop doing that. We've got to treat these businesses like we would treat every other business and help them, but help them in the same way that we help other businesses. And I think that's possible to do it if we have people that are willing to negotiate that deal with the owners.
And you're willing to let Minnesota perhaps let the team go just to stand up for that principle?
Well, I'm not willing to let them go. I think we should do everything we can, but we have to make it clear to the public that we are willing to offer a deal that is a good deal, a deal that any business would be willing to take. And if the team doesn't take it, well, I guess that's their decision. We ought to be willing to put a deal on the table that is a good deal.
Do you have any ideas that you'd like to make public right now?
Well, I have ideas, but nobody's talking to me, I guess. I don't know who's involved in the negotiation. I know the governor has a plan that he's thinking about, so I'm assuming that they're talking. But the point is that the people who are negotiating have to negotiate a deal that is going to stand up to the scrutiny of the public, is not going to abuse the public's taxes for other purposes, and is going to be commensurate with other deals that we do for businesses. We are all interested in keeping business in the state, and we ought to treat businesses fairly and equitably, and we ought to work harder at making the business climate of the state as a whole attractive, not just offer a sweetheart deal to one organization.
Okay, and Senator, before we move on to health care, I just want to be clear. Do you consider expansion of gaming per this Viking Stadium issue, video pull tabs, a lottery game, is that expansion in your opinion, or is that just what already exists?
Well, I think given the nature of gambling, and there's a lot of research on this, that the more venues you have for gambling, the more people gamble. That is a truth. You can look it up, you can check it out. There's all kinds of research that points to that. So anything that you do that offers people more of an opportunity to gamble, you're going to get more of it. And the real question is, does that make sense? Do you get an economic benefit from more gambling? I don't think you do. The research in my mind is very clear. So I think anything that we're doing to expand that is bad. We ought to work harder at closing it down and finding better uses for the money that people devote to that exercise.
Okay, Senator Hann, let's move on to health care. The governor earlier this week issued an executive order creating 2 different task forces. Let's begin with the insurance exchange issue. We had you on the program about a month ago, a little over a month ago. You essentially state that the governor does not have the authority to move ahead on this issue and plan to perhaps even take it to court. So where do we stand on the issue at this point?
Well, we are still looking to have the governor and his administration come to the legislature and talk to us about what their plans are, what they're doing with the money they have gotten. They've received some grant money from the federal government in a way that we think is a little questionable in terms of the process. That's a little bit of inside baseball sort of an idea, but we are very strongly questioning what he's doing and why he's doing it. But he has not come to the legislature and made it clear this is what we're trying to accomplish and this is the way that we're going to get it done. We're very concerned, first of all, that this law, the federal health care law, is being challenged in court. There are a number of states that have participated in that lawsuit. Minnesota is not one of them. But we think it's premature to rush into something until it's clear what exactly it is that we need to do and whether or not that demand by the federal law is in fact constitutionally warranted. So we're urging caution, number one. But number two, if you are going to do something like a health insurance exchange, it ought to be done in the legislature and not behind closed doors with the governor's office. Now, I understand this task force is, he's inviting different people to meet with him and to do something, but it's unclear to me what exactly they're aiming at and what exactly they want to do, and I think they ought to come to the legislature and talk about it.
They will have legislators on these task forces, is my understanding. Have those folks been tapped yet? Has anybody been asked?
Well, as I've understood it, and what I have seen is they have invited legislators to come and sit in on the committee, but without any authority to vote, or I'm not sure even what the organization of the committee is. I am not going to participate in that. I have not thought that that is the right way to do this. I think that their approach to this is wrong, and for me or other legislators to join in that approach sort of sends the message that they have the cooperation of the legislature, and they don't. They have not come to the legislature and talked about what it is they want to do and how they're going to do it, and they need to do that.
Okay, let's move on to the other task force that was created, and Commissioner of Human Services Lucinda Jessen will chair that particular task force. They're tasked with finding ways to lower costs and improve delivery of care, something that you agree with as well. So what would you like to see put in place and some of the recommendations from this task force if you were to help craft it?
Well, I think that certainly all of us are in favor of reforming healthcare. I think that we really have a choice at this time in our country of looking at directionally two ways to go. We can either go down the path of saying we want more government involvement at the state and federal level in decision making, we want more centralization, we want more bureaucracy, more regulations, or we say, no, we want to try to find ways to expand the marketplace, which is simply giving people the freedom to make choices about their health care and creating a structure that allows for greater transparency so people know what those choices are. That's what I would argue for. I think one of the problems that you have is that there's a very strong appeal when people say, well, we're going to plan out this thing, we're going to make a big plan and we're going to implement this plan. Well, you're talking about, what, 1/7 of the economy, and you're going to who's going to plan that? There's never been, to my knowledge, any successful attempt to do planning on a large scale of a major economic sector of any economy in any country, and we are wrong to try and do it in healthcare. What we should be looking at is how do you enhance the market? How do you get more competition? How do you get more insurance options available to people? That's what we should be doing, lowering mandates, increasing competition.
And so what do you think the greatest impediments are to improving healthcare and the delivery of service?
Well, I think, frankly, the biggest impediment we have are the federal laws that have been passed going back to the 60s. I think Medicare, for example, was a hugely problematic structure that is getting worse and worse as time goes by. You've got a structure that is basically paying a fraction of the cost. It says we're going to pay for health care, but if it costs $1 to do something, we're not going to pay $1, we're going to pay 50 cents or 40 cents or whatever it is. Well, the rest of that cost gets shifted primarily into the private insurance market, so other people are picking up the costs. And so you create a system that is not transparent. People do not know what things cost. The costs are being shifted around, and meanwhile people believe that somehow this government program is paying for it, and it isn't. It has hugely skewed the information system that you need to have a free market. So I would look at, first of all, how do you change some of the federal laws with respect to health care and diminish the interference in the marketplace. And absent that, and we're probably a ways away from that, I think you have to look at the state level, how do you do things that restore the ability of legislators and elected people in Minnesota to have meaningful impact on what decisions we make about health care in this state. Things like what kinds of insurance are we going to have, what kinds of payment structures are we going to have. And there are things we can do, but they're limited by the federal laws, frankly.
Okay, we're out of time, unfortunately, but Senator Hann, always great talking with you on these issues. Thanks for joining us.
You bet.